morning, everybody. Excuse my voice. I thank God for having us here safely, and I thank the organizers for inviting. Social Security Regulatory Authority is the authority enacted by Act Number 8 of 2008. Their core functions are to safeguard interests of members. So when we talk about the informal sector, we consider them as members who need to be protected. So we register scheme, we issue guidelines, and then we supervise the implementation or compliance of those guidelines. But we also advise the minister responsible for social security on all policy matters. And in case of Tanzania, the minister responsible for social security is the Minister of State under the Prime Minister's office. So we monitor the performance, also we initiate reforms, and we also implement reforms. We basically deal with extension of social security, and we also do public awareness. We have a number of powers that we conduct actuarial evaluations according to Section 25. Before establishing any benefit, we have to conduct actuarial evaluation, but we also take disciplinary measures, including penalties against managers of schemes or custodians who have not complied. And we conduct inspection with or without prior notice. And also we set contribution rate after doing actual evaluation, and it also involves stakeholders. The social security system in Tanzania, I think Luis touched about it in the morning, that we follow ILO framework, that tier 1, which is social assistance schemes, and we have tier 2, which are mandatory social security schemes, and tier 3 are supplementary schemes. In terms of pension schemes, we used to have 5 pension schemes, but according to Act Number 2 of 2018, these have been merged into 2. So we have a National Social Security Fund for private and informal sector, and then we have PSSF, which is Public Social Security Fund for the public sector. But all these pension funds had a voluntary window. That is, you could see on the right-hand side, GPF. For you, it's left-hand side. For me, it's right-hand side. On your left, you see GPF had a voluntary saving retirement scheme. This was a supplementary scheme, and I'll talk much about that. And Parastatal Pensions Fund had a deposit administration scheme, and PSPF had a pension savings scheme, and LAPF, which is Local Authority Pension Fund, as DC, which is defined contribution schemes. And NSSF had a number of schemes, had a Wakulima scheme, this for agric sector, had a Wavuvi scheme for fishing, and had mining scheme, which is called Madini. But we also oversee community health funds, I'll talk about them, and we have health insurance fund, and we have workers' compensation. These are under the mandatory. Secretary? Thank you. These are basic benefits for the mandatory schemes. And I know for the informal sector, they are not interested in all these benefits. They have specific benefits for them. So for the case of Tanzania, you'll see we have the informal sector and agricultural sector. You see 75% is an agricultural sector. And then we have self-employed without employees at 10%. And self-employed with employees around only 2%. We have unpaid family helper in the Greek, around 9%. And we have 4% unpaid family helper in non-Greek sector. This is the definition of the informal sector. I won't want to take much time in that because we discussed so much yesterday. And also the employment in the informal sector as well. That we also, I won't want to take much time in that. And this slide is also under the definition as well. But I want to talk about barriers. There are a lot of barriers. We talk about them yesterday. Some of the cases that people engaging in the informal sector are poor. That is the myth about the informal sector. Then that is the barrier. And at times themselves they think they're very poor. And the sector is unorganized and unstructured. So that is another barrier, that often mechanism networks of financial services, training, market, and welfare. These largely rely on traditional kinship, neighborhood, occupational family ties, and have proven to be effective and durable. So it's not true that they are unorganized or unstructured. We refer to the presentation made by Professor. So it's also another myth is that informal activities are illegal. So you see that, the case that regulations do not apply to an affordable cost and the compliance with existing regulation will impose activities and put at stake their ultimate survival. So once you say maybe you want to clean the city, look at these people here, it's like, they don't look so nice. So it's the case that we discussed yesterday. And then another barrier of the informal sector, lack of enabling legislation. It's only in Tanzania this year we had that Act number 2 of 2018 has recognized the informal sector and has placed the mandatory role under the National Social Security Fund. Inability to enforce legislation as well, and existing framework are quite unfriendly, especially for the mandatory schemes that you have to require to contribute regularly. For the case of Tanzania, you have to contribute on a monthly basis, and then you have long vested period. In Tanzania, in order to qualify for pension, you have to contribute for 15 years. And there are penalties for non-contribution or delayed contributions, and lack of attractive products. Lack of awareness of benefits is also the barrier to the informal sector, and lack of access to information and services. The case of Tanzania, out of 22 million, 4.3 are estimated to be employed in the informal sector, and 13.3 million in the agriculture sector. It's like the pie which I've already shared. And this is also, I think yesterday the presentation, they indicated that in the Social Security Regulatory Act, there is a specific section on informal sector, section 30 has been revised. Excuse me. And section 25 as well, and section 54. All these allow to incorporate informal sector. Excuse me. Efforts towards information informal sector, you could see that we have legislation and we have supplementary schemes under the mandatory schemes. The success story is the voluntary savings retirement scheme. Please forgive my voice. This voluntary saving retirement scheme is a product which is an innovation which has been done to capture the informal sector. So you could see here the products and services were developed to meet the requirements of the informal sector. So there is flexibility. You can contribute daily, weekly, monthly, or any period that you think is appropriate. And for the farmers or for the farming sector, you can contribute in the form of eggs, like in the collection sectors. You collect trays of eggs, like you bring 10 trays, 1 tray can go to the Social Security. Or 10 liters of milk, then 1 liter goes to the Social Security. This is priced, then at the end of the month, the message is coming to you showing how much you have contributed. And because the survey indicated that they want to get something out of that, they're allowed to withdraw up to 50% of their contributions. So if you want to buy another cow, and you have contributed liters of milk, which are adequate, 50% of which is adequate to buy another cow, you can withdraw that and buy a cow. And for food vendors as well, they can contribute on a daily basis, and you don't have to go to the GPF office. You can contribute through using mobile money. And when they register you, they come to you. You don't have to go and ask to fill forms and go to the studio and take a passport size. They come, they take your photo, they help you to fill in forms, and you get these reports regularly. And there is no minimum amount that you should save each month. So it's just to encourage you to save more. Even for a motorbike or motorcycle, you want to buy your own, you can contribute in a way that you'll be able to buy your own after some time. So each member has 2 accounts. One account is for pension and one account for your own needs. So this is the scheme. So we have very flexible collection and registration system and payment of benefits. GPF supplementary scheme, a number of males, females, males are 55%. You could see fishing, mining, employed and trading, mostly trading. They find it very flexible for them. So you see the contributions. The contribution, you will see we have some who are contributing up to 500 Tanzania shillings, up to 5,000 a day. This is another intervention. I think Louis talked about it in the morning, the community health funds. We, as SSRA, we have already registered 166 community health funds, which is which covers about 2.2 million households, and they have 12.6 million family beneficiaries or dependents. And with it's a matching fund, you contribute you contribute 5,000, and the government tops up 5,000. And in some councils, they are also very innovative. Like there's a council that the central part of Tanzania, they contribute in terms of coke. 10,000 is the price of coke. So you go and you know that the selling place, they can sell chicken at 10,000, and then you know if you're keeping chicken at a certain level, you're already covered, because you will go and exchange and get money to pay for your health insurance coverage. So this health insurance coverage for us, we think it's a proper place where we can utilize and use and develop a window for social security. And Tanzania now is towards universal health coverage. So we think through this we'll be able to develop